I would like to welcome everybody, and we have a real treat for you today. Our next presenter is someone that we have placed in our circle of honor for all of her groundbreaking work, and our circle of honor is like a hall of fame. And Dr. Emma Bragdon spent 6 months of each year, 2001 to 2012, in Brazil, learning from and participating in spiritist activities. She has written 2 pioneering books and co-produced 2 documentary films about these activities. She was so inspired by her experiences, she founded Integrative Mental Health University, IMHU, in 2013. IMHU currently offers 40+ courses emphasizing the positive potential of spirituality in mental health care. And with that introduction, I'm going to turn this over to Dr. Emma Bragdon. Thank you.
Thank you so much, Robert. And it's a pleasure to be here with all of you. I want to thank you so much for the invitation to speak to your group. And I'm especially amazed at what you have done in the last couple of years. You've been convening as Spiritual Awakenings International. So you may wonder why I have a surfer on the top of the screen. And I have a surfer because this person is dealing with some really powerful and profound energies and trying to maintain balance. And I think that speaks to what spiritual emergency is about. So I will be speaking today about spiritual emergency, describing what it is, how it relates to spiritually transformative experiences. And it doesn't have to be a crisis if someone has the appropriate support to maintain balance. So the agenda for the talk is that I'll do a slight imagination process for you, and then tell you about my story with Spiritism briefly. I'll go into the relationship between spiritually transformative experiences, spiritual emergency, especially looking at the positive outcomes and what's needed for a positive outcome. I'll then spend most of the time talking about Spiritism, the successes that they've had with working with people in spiritual emergency, speaking more in detail then about spiritist therapies, and asking the question, can we import what is being done in Brazil into countries outside of Brazil? And I'll give some resources for further exploration towards the end, and we'll have time for Q&A. So imagine, if you will, that you are in a position of being overwhelmed. Perhaps you've had many or just one, but some spiritually transformative events that may have taken you into a place where you're hearing voices. You may have had a near-death experience so that you were hearing the voices of people who had passed away, but you're coming out of that experience, but you're still somewhat in it and feeling quite overwhelmed. Asking yourself, maybe, am I crazy? And what's going on here? You haven't listened to Mark Anthony's talk. You don't understand yet the science of spirit communication, and you're steeped in the language more of reductionist science, materialist science that we all have been educated into. And you're wondering what is going on. And you are living in a place where there is a spiritist hospital. So you may not understand what Spiritism is all about, but someone takes you to this hospital, and as part of the assessment, you see a medical doctor. You're being checked out for any kind of physical issues. Have you had some kind of brain problem? Have you had a stroke? Is there something going on a physical level? And you're checked out by a social worker. Are you having some kind of real difficulty just in your life as a whole with issues, for instance, of poverty or prejudice, etc.? Perhaps you've had trauma, so you're assessed for that. But then you also get reviewed by a medical intuitive. And this person a kind of medium in themselves can look into the energy field around you, can look into the energy inside of you, look into the energy of your spirit, your EMS, as Mark Anthony was talking about, and be able to consider what is really deeply going on with you, and possibly what your gifts might be that are coming forward. You're also given the opportunity to have blessed water, which has been given vibrations that allow it to be a healing force in your life. You're given energy work, so in the form of what is called energy passes, so that is to disperse any kind of negative energies that are around you and to strengthen the balancing of your chakras. If this does not completely work for you, along with other conventional therapies, for instance, seeing a psychologist, then you may be given spirit release. And in the frame of reference that the hospital has as a philosophy, there are, in fact, negatively motivated spirits that can attach to people and need to be released so that the patient themselves is liberated and the spirit is released to go into the light. The other thing that happens in this hospital is you're offered a very wholesome diet. There's physical education in the form of, let's say, soccer fields in the back of the hospital. And if you actually are hearing voices that are positive, that are helping you actually to see a broader picture of what's going on with yourself and also with others, it may be that you're identified as kind of a medium in the rough, or a healer in the rough, a diamond in the rough. So even though you feel like you're in darkness, like coal, actually what's coming forward is the potential for you to have training and be able to be that diamond that lies in the depths of yourself. So in this imagination, you might say, gee whiz, where can I go to have that kind of treatment? Where on earth does it exist? Is it possible to have this in the United States or anywhere else in the world? And I'll tell you, this particular kind of care is available in Brazil. And that's what we're going to be talking about. So the Spiritist Hospital is what I was just exploring with you. And I knew nothing about it until I went to Brazil in 2001. I was there because I was asked to teach teachers about how to teach a 9-day personal development course. So I did that during those 9 days. And then a friend of mine who is paraplegic asked if I would go visit John of God to see if he might be able to help my friend walk again. After the interaction I had with this man, who was a world famous healer at the time, several mediums walked up to me and said, "Oh, you're here to bring spiritism to the rest of the world." I'd never heard the word spiritism before. I thought they must be wrong. But actually, as a result of, well, I won't say as a result, but synchronistically, that particular evening, I started meeting leaders in Spiritism, and that eventually led to my writing books and creating film, as Robert was mentioning. So one of the books was Spiritual Alliances that I wrote after I had spent time with John of God at the center. And it was basically talking about the strength of spiritual healing for both psychological and physical issues, and how we need to bring that into our healthcare in the United States and outside of Brazil. So I wanted to just share with you that I had to question myself very deeply. Was I asleep in graduate school? There are 20 to 40 million Brazilians who use Spiritist community centers when they want to look deeply into the origins of their illness or their disturbance, and thus be in a better position to be healed or effect healing within themselves. And what I started to understand is that no, I had probably not been asleep. It's just that Spiritism was never mentioned. And the only psychologist who had really spoken about this at the time that I was looking, which was about 15 years ago, was Stanley Krippner. And he didn't get into the depth of it that I was able to get into. So as a result of being profoundly inspired by the hospitals and also the community centers, I came back to the United States and started Integrative Mental Health University in order to bring more of spirituality into our mental health care system and make courses available to people so they could learn more about the positive potential. So I just wanted to mention the 2 books that I've written on spiritual emergency are a source book for helping people with spiritual problems that's used in some graduate schools now to help mental health care professionals learn more about spiritual emergence and emergency. The Call of Spiritual Emergency, which are more stories about spiritual emergency and what it is and how what the outcomes can be when people are cared for in the right way. And then 2 books on Spiritism. One, Kardec's Spiritism is like an armchair journey into several Spiritist centers in Brazil. Spiritism and Mental Health on the far right is more academic and includes Spiritist psychiatrists speaking about mental health with Spiritism in Brazil. And also researchers and clinicians from the United States and the UK giving their point of view, and then the documentary films about Spiritism. So in the resources section at the very end, I'll let you know if you want to know more about these, how you can find them. So just a little bit about spiritual emergency. So in the teaching that I do and in my understanding, there are about 12 categories of spiritually transformative experiences that can lead a person into a crisis. And the kind of crisis that people get into are that they have had experiences that are beyond ego, beyond their conditioning of believing in the 5 senses, and they don't have a framework to deal with it. They can't understand it. They feel oftentimes very disoriented by it. And many people like Eben Alexander have spoken about, and he was a neuroscientist, he still is, have spoken about the tremendous transformation in thinking that can happen, because prior to his NDE, he didn't believe in the kinds of experiences people were having through NDE. And then he had one himself that was profound and completely changed his thinking and also changed his life and his whole work life, as well as his partner, intimate partner, as a result of the NDE. But this can take some time. So like a caterpillar going into a period of transformation, they sequester themselves in a pupa where they have enough nutrition and to make their transformation, but they are in fact moving into a completely different kind of being, which would ultimately be the butterfly. So we see this in nature, and it's a completely normal and natural process. But we think about it now through the language that we have, which is spiritual emergency. And it can include a radical change in identity. I haven't seen any human being turn into a butterfly yet, but I've certainly seen human beings transform profoundly and shift their sense of who they are and what life is about and what death is about as well. So the most important thing about making this transition in the human realm is to gain appropriate support, because the conventional system still doesn't recognize spiritual emergency. So conventionally trained healthcare providers have not learned how to recognize spiritual emergency or give people appropriate support. This is one of my favorite cartoons. So this cat in this case has lost their identity, and they're even posting that they're lost. even though they're in their own body. So this particular cartoon, I think, is really similar to an existential crisis, but with a spiritual crisis or spiritual emergency, we're always having strong spiritual experiences that are disorienting. So one of the difficulties with a spiritual emergency is it can be, especially in our conventional system, it can be confused with symptoms of mental illness. So for instance, a person coming out of a profound NDE, for instance, may appear to someone who is steeped in the five senses as being out of touch with reality. But we have to ask, which reality, of course, are they out of touch with? Maybe they're just much more in touch with a reality that we don't usually respect. But a person in spiritual emergency will also feel disoriented. And oftentimes they're paying less attention to their hygiene, less attention to their diet. They're perhaps not sleeping as well. And they might also become very self-absorbed. Think of, again, the caterpillar in the pupa, just with itself. And so in that sense, a person going through this transformation process may find it very difficult to do their regular work and the chores at home, including childcare, et cetera. But we have to realize that that wonderful science that Mark Anthony just described has not fully integrated into our conventional hospitals and mental health care systems. So we really are still operating as if some of the spiritually transformative experiences aren't real and people are possibly hallucinating or out of touch with reality when they're having these experiences and going through a transformation. What can happen when a person in this spiritual emergency presents to a conventionally trained healthcare provider is that the healthcare provider might say, there's symptoms here of psychosis. It looks like the person may be very anxious because they can't understand exactly what's happening with them, and they're confused, and they don't like that. And so psychiatric medication may be the most compassionate response. And if the person is extremely scared by all of the change that's going within them that they had had no preparation for, they might actually embrace the notion of going to a hospital and being cared for. And if their family and loved ones are also scared by all the transformation and change that's going on, and the person speaking about things they don't understand, they also might advise hospitalization. But that's not exactly where we're going. We're going more in the direction of what we were imagining at the beginning of my talk, which is a very different kind of care than one finds in a conventional healthcare system today, where someone most likely would be medicated and most likely would be in a zone where they're with other people who are also medicated and who are also taking on the identity of having a mental illness, rather than taking on the identity of going through a very positive, spiritually transformative event. So I want to tell you the story of Marcelo. He has given me permission to share his story, and he's someone that I met when I was in Brazil. This is not his actual picture, but he was about 28 years old when this story happened. So he comes from a well-to-do family in Brazil, and it happens to be a Catholic family. His father was a banker, and Marcelo at 28 was working, had a nice circle of friends, and was enjoying his life, and had no significant trauma. But unfortunately, he just started to feel somewhat depressed. So his parents took him to a very well-known psychiatrist. He was given medication, but he still was not improving. In fact, things started happening. He started hearing voices, sometimes 3 or 4 different voices simultaneously, which were extremely aggravating for him. And he thought to himself, I know exactly what this means. When you hear voices, it means you're crazy. So I'm a lunatic. This is horrible. My whole life is changing. The other thing that started happening to him was he started feeling a lot of energetic phenomena coursing through his body, which to him, he would imagine, oh, they're bugs or something crawling around me and I've got to get rid of them. This feels very uncomfortable. So he was very self-absorbed, very irritable, and very much convinced that he was a lunatic and that things were just devolving in his life. He went into a psychiatric hospital. Things didn't improve. He continued to hear voices, continued to have the experiences, even though he was now on anti-psychotics as well. His parents were extremely upset, and eventually, I'm making a long story short, found a spiritist hospital where Marcelo was able to get the kind of treatment that I told you about at the beginning of this particular talk. So that involved energy therapies. It involved, which he was able to receive in the hospital from trained energy healers twice a week. It also involved his being able to be assessed by a medical intuitive who could see that he did have some things psychologically to take care of, which in his case meant learning how to be more forgiving to his own family. So there were some parts of his family, meaning his extended family, that he hadn't forgiven for certain things that had happened. He had to learn how to be more forgiving, but more than that, even, he had to recognize that there was such a thing as mediumship. It was a God-given gift, and those people who have this God-given gift need to be in a situation where they can be trained how to use it safely in order to help themselves in their own process of becoming more self-aware, but also, and even more important, in order to help others. So he began that in the hospital, he began that process of learning about mediumship, learning about energy healing, and actually having more interaction with people who were like himself, who were gifted in these particular ways as mediums and energy healers. And then he was transitioning out of the hospital and being able to get training at the Spiritist community centers close to the hospital and affiliated with them. And by the time I saw him, which was several months after he had initially gone into the hospital, he was actually, as someone who had left the hospital, he was going back into the hospital to give patients energy healing work. And he had selected a woman who was a very well-known channeler, channeling beings of very high intelligence. He was basically choosing her as his mentor and was in training. His father and mother were so deeply impressed. What they said to me was, crying, they said, "We have our son back." And his father was so amazed by what was going on, he actually started being in training himself as a medium. So the outcome was totally extraordinary. I've never heard of anything like that happening outside of Brazil, because we don't use the kind of assessment tools that they have in the Spiritist centers and Spiritist hospitals. And we don't offer the kind of training that has been cultivated in Brazil for over 100 years. And certainly we don't offer the kind of community that Marcelo was able to cultivate in the hospital itself, as well as outside the hospital. And being part of that community of like-minded people was extremely important in his own healing process. So with appropriate support, someone in spiritual emergency, like Marcelo, will have a tremendous increase of well-being, and will have more healing happening within themselves that might be self-generated or might be generated by a community, more peace. They oftentimes can move into being more telepathic. And many people who go through a spiritual emergency develop healing abilities, discover them actually in the process, and are more sensitive to energy, so they can see it, and they can more easily then work with other people to help them with any kind of congestion that might be happening in their energy. So they become energy workers. And people who go through this process successfully also become more highly intuitive. They have an improved ability to relate to others because they have more empathy and more compassion. And most likely, they have a strong desire to be in service to other people. And so they want to use their gifts to help others. The other thing that goes on for people who go through this kind of emergency, spiritual emergency, and have the appropriate support is that they're increasingly more interested in living from the soul rather than the ego. They have more self-awareness, and they truly are looking for being part of a community that's oriented towards the values of sustaining life and preserving nature. Many people become activists, environmental activists, who have gone through this process of spiritual emergency. And they clearly are very interested in letting go of any dependency on psychiatric medication. The unfortunate story, and it happens quite frequently actually in cultures that do not have spiritism as available to them, is that people who do not get appropriate support, for instance, in the worst of cases, they are given the notion that they have a mental illness and that they need psychiatric medication, and they might need psychiatric medication for the rest of their life. So they're more apt to think of themselves as mentally ill. They're more apt to think of their inner experiences as hallucinations or delusions. And there's a continuation of fear inside themselves, and sometimes even shame or guilt, not feeling like they're good people. So within that, they would have a tendency to isolate and also be more impatient with themselves and more emotionally reactive with others. I've known people who have not been successfully cared for, who really lose interest in self-care, and they lose interest in life itself and become extremely dependent on psychiatric medication, especially if they've taken in that notion that they're mentally ill and do not have any cognitive framework for some of the gifts that actually may lie within them that need to be cultivated. So one of the difficulties that people will have too is they become very involved with their inner life, which might be an inner life of not accepting themselves or feeling badly about themselves. And they become more out of touch with conventional reality, meaning that they just don't feel adjusted to being in the world as it is. So those people who do get the right support and feel like they're absolutely accepted and even celebrated within community can get along in the conventional reality very well, and can also find a way to express their God-given gifts in order to help themselves and to help others in a situation that is set up for them to do that. So what do we need in order to help more people who are having these profound spiritually transformative experiences and possibly moving into a spiritual emergency? What do we need in order to help them? And discernment is obviously the first thing. So we need to be able to discern who is it that is in a spiritual emergency process and who might be in a psychologically difficult period in their life, but possibly has some gifts in terms of their own spirituality, and what kind of support do they need. So all of this is asking of us that we really fine-tune our discernment. Healthcare providers today obviously are in a position to need this discernment when they're in hospitals or clinics, where someone might show up and say, I don't know what's going on. I'm scared. I think I'm going crazy. I want your opinion. And unfortunately, the healthcare providers today who are going through their conventional education in order to be licensed are usually not told anything about spiritually transformative experiences or a spiritual emergency. So they don't have the tools, they don't have the knowledge, and they don't have the skills to help with discernment. And they're much more apt to see all spiritual experiences as delusion. And of course, people who are having the life experience may be also prone to say, like Marcelo was, gee, if I'm hearing voices, that means that I'm crazy. So we need more psychological education in schooling and for everyone, so that they understand that there is this process that can be spiritually transformative experiences or possibly leading into a spiritual emergency. This is a process that is normal and natural and not part of mental illness. And so we can better understand it within ourselves as well as in our family and in our community. One of the difficulties that can happen with people who are moving through strong spiritually transformative experiences is they can become extremely self-absorbed in the spiritual life, which on one hand can be absolutely wonderful for cultivating the gifts that they have. But on the other hand, there may be, like there was for Marcelo, some psychological material that may be needed to come for healing. So psychological healing can be extremely important when we're moving towards offering our gifts to the world. For instance, like Marcelo, he began to be able to offer channeling as well as energy work for people. And he was a much clearer vehicle for that because he'd done the psychological work that he needed to do to clear himself so that he could then be a clearer channel for other people. Another favorite cartoon, which I relate to personally, you might as well. The problem is I can't tell the difference between a deeply wise, intuitive nudge from the universe and one of my own boneheaded ideas. So I'm making every effort through meditation and prayer to increase my discernment. But it is something that doesn't come naturally to everybody and something we usually have to work on. And it can be a lifelong effort. So along with discernment, compassion and understanding is extremely important to offer someone who is having profound spiritually transformative experiences and may feel frightened by them. They need a sense of connection as they're walking through the dark wood, as it were, graphically portrayed in this particular picture. So this leads me into talking more about Spiritism. And Spiritism actually originated in France, but it has been really popularized in Brazil, and Brazil seemed to be extremely fertile ground to accept Spiritism. One of the reasons that I see that they have been able to so brilliantly support people like Marcelo is that there are three keys that they have. First of all, they have cultivated discernment. And if it isn't the nurses or the conventionally trained doctors who have the discernment, these nurses and doctors have access to medical intuitives and can work with them so they can, as a team, do more subtle and clear diagnosis. They also, another key for working with spiritual emergency and helping people towards the best positive resolution is that the spiritists have a profound understanding of energy and how to apply healing energy in various forms to help people manage a spiritual crisis or spiritual emergency and move into more integration. They also take as a very powerful value and something to cultivate within themselves in the work of being a spiritist is loving compassion. And I think probably all of us would agree, if we have the good fortune to be around someone who has loving compassion when we're feeling ill, that it can help us to feel better, whether we are psychologically in distress or physically in distress. So just to describe a little bit more about Spiritism itself, it's thought of as a way of life. It's not a religion. And it's also not a misspelling of spiritualism. So it originated by a man who was actually an academic in France in the middle of the 19th century. He wrote as Allan Kardec, as his pen name, and he wrote 5 foundational books. Now, was it him that was the philosopher? No, it was actually him interviewing 1,000 or more mediums to answer some of our most essential life questions. What is life about? What is the goal of life to be? What is death about? What happens in death? Is there spirit communication? If there is spirit communication, are there negative spirits, negatively motivated spirits? Are there positively motivated spirits? How can we be more in touch with the positively motivated spirits and bring them into our lives so that we can have more wisdom and compassion? So he was asking thousands of questions and collating the answers that came through most commonly from literally over 1,000 mediums, which doing that without the internet was a piece of work in the mid-19th century. So what Spiritism began to formulate was it was to be based on the philosophy that came through these mediums, and it was to fully respect science. So if science moved ahead with belief structures, then science would trump the philosophy that was written. To this day, there hasn't been anything that science has come up with that has refuted anything in any of Kardec's books. And ethics is extremely important as a cornerstone. So if the reason for life is for all of us, each of us, to spiritually evolve. And in order to go through that evolution, we need to have ethics and the cultivation of personal ethics be a cornerstone of our life. Some people think of Spiritism as a practical way of Christianity, but what I've learned is that actually it is completely ecumenical. So it embraces people from all cultures, all religions, all sexual orientations, all philosophies. And it's not only for Christian people. And in fact, some Christians, and Marcello's family, as Catholics were one of them, would say, no, we need to stay away from Spiritism. It believes in karma. It believes in reincarnation. There are mediums who work there. That's a little crazy from our point of view. But however, the Spiritists do take Christ as a model of someone who has spiritually evolved. And we all need some kind of a model, and there are many models, but Christ is certainly one of them. Many people will ask me, well, what's the difference between Spiritism and spiritualism? They sound so similar. But spiritualism, when it came about, and that was really, people generally say around 1840, in that zone, in the United States at least, the way it first came forward was there was a fascination with phenomena. For instance, musical instruments that would play by themselves without anyone physically playing them. Or there's a graphic of President Lincoln, whose wife was interested in spiritualism. President Lincoln actually sitting on top of a piano that was moving by itself, like imagine a piano walking. So there were some very dramatic phenomena that happened in spiritualist meetings or seances that had to do with spirits actually making some things move without any kind of obvious physical interaction going on to make these physical heavy things like a piano move. So one of the most important things to remember about the Spiritists is that they do believe in a lot of interaction going on between disembodied spirits and those of us in body. And one of the things that came through the mediums who actually were at the bottom of the philosophy of Spiritism, as I said, is that they are very clear that there are spirits that are negatively motivated. And it might not be that they want to hurt someone, but they just may be a bit ignorant, or they may just want to play tricks. So we have to be extremely careful if we want to get involved with any kind of spirit interaction, to be calling only on those spirits that are highly intelligent, very compassionate, and have goodwill. In other words, they may be even dedicated to participate with our healing and our wholeness. So the mediums who identify as spiritists and work within that movement of spiritism are work to become extremely well trained. They may, in fact, work for decades with the same group so that they can cultivate their skills, but also become less involved with their egos. And as we all know, you try to do something in a group, maybe it's even take a hike in the woods, and there may be someone who just has to be the leader, and there may be someone who just feels like they really don't mean very much, and their ego things that just become involved. It happens in all groups, but when the mediums work together for decades, they become highly tuned to each other, as well as encouraging work together that moves outside of the ego and can be very clear in order to help other people. So I mentioned, I think, that there are over 13,000 Spiritist community centers in Brazil, and they are basically offering the same kind of things that happen in the hospital that I've already spoken about, but it is not a hospital environment. So you might even look at a Spiritist center, a large one, and say, gee, it looks a lot like an office building. What's going on in there? But it has rooms for classes, for study groups. People get together and they talk about, well, in the Spiritist book, it says that life is about spiritual evolution, but is it really like that? And how does Spiritism connect with the various things that are going on in the world today? And how are we supposed to live as a spiritist in the world today? So people get together to discuss, but it's not about promoting the spiritist point of view or having to engage it and let go of everything else. It truly is helpful for just people being able to wrap their own minds around the philosophy, understand it, and make their own choices about what they want to believe. I was very impressed with that. So also within the Spiritist community centers, they do offer the energy work. They offer lectures. There's prayer groups sometimes. There's a lot of charity work that is done to benefit the community, but there is also training of mediums and healers. So if a person identifies that they actually want that kind of training, they can go to a Spiritist community center and just sign up for it. And it's all for free. There are about 50 Spiritist psychiatric hospitals in Brazil. I don't know of any outside of Brazil. And in those Spiritist psychiatric hospitals, they will offer the very best of conventional psychiatric care, so that they would have, the closet with all of the psychiatric medications if needed, but they're not going to over-rely on the psychiatric medications. They're only going to use them as needed and usually for the short term. And in addition to offering the Spiritist therapies, they will also offer some of the newest and best kinds of therapies that are available throughout the world. For instance, family systems therapy is being offered now in some of the Spiritist psychiatric hospitals. One of the things that impressed me the most is that the mediums and healers who work in these hospitals collaborate with the psychiatrists. So very frequently in our hospitals, at least the ones that I've visited, the psychiatrists are the ones who are the chief authorities, and there's clearly a pyramid or a hierarchy of power. And there may be some teamwork in name, but everybody knows that there's also, let's call it a pecking order. And so psychiatry and the people who've been indoctrinated more into the psychiatric point of view, which tends to be very biochemical today, are the ones that have the most power. Whereas in the spiritist psychiatric hospitals, there may be psychiatrists there who've definitely taken the conventional training and are licensed as psychiatrists, but they also are open, very open to what is being told to them through the medical intuitives and the mediums and healers, and what they're picking up about the patients and what the patients need. So it can be a very different working environment. They also can, I've met several psychiatrists, more than several, a collection of psychiatrists who I'm happy to say are my associates now in Brazil, who are not only very highly trained psychiatrists, but they're also mediums and have been throughout their life. The Spiritist psychiatric hospitals also offer residential as well as outpatient care, and they bend over backwards to help people, whether people have a lot of money or not. So the federal government does offer some kind of subsidy, but it's not a lot of money. And both the Spiritist community centers and hospitals are really relying on donations in order to continue. So I just for historical perspective, I wanted to mention that the Spiritists have been working with something that we would call spiritual emergency for over 100 years. So they've not only been able to recognize it and say, yes, this is something that we deal with and that human beings deal with, and we need to figure out how to support people in the most appropriate way. So they've been cultivating how to do that most successfully for more than 100 years. And from my perspective, then, they're a very good model. So I also wanted to say that in my years of, 15, 20 years now of trying to describe these community centers to other people, I would say they're like a convenience store because you can find them in so many different locations. Some are small, some are large, some happen even in living rooms with up to 5 to 10 people. But 20 to 40 million people, that's a fifth of the population of Brazil, will choose to go to a Spiritist center to gain the perspective of what is the spiritual roots of my illness or my distress, and how can I work with it. So they might not self-identify as a Spiritist because it's not a religion, but they may identify as a Catholic, but still they might go to a Spiritist center if they're needing some support. So how do these people who are Spiritists, mediums, medical intuitives recognize spiritual emergency? They have a word for it in Portuguese, which has to do, which I won't go into because it's a bit complicated, but it translates well into repressed sensitivities. So those sensitivities might include actually the ability to communicate with spirits. They might include the ability, tremendous ability to see energy and work with energy. It can include a lot of things that are wrapped up into various forms of communication with spirits and with energy and with non-ordinary states of consciousness, which of course can enrich us tremendously if we integrate them. So the medical intuitives are able to see the energy field in and out of the body, as I mentioned. And what happened with Marcelo when he entered the Spiritist hospital is they could see in his case that there were not negatively motivated spirits impacting him. But in the case of other people, if they do notice that, and the patients in, let's say, a Spiritist psychiatric hospital are not responding positively and not changing as a result of the more conventional care, or including the energy passes, the energy work, and the blessed water. If they aren't responding, they might be able to have what is called disobsession, which is similar to what we think of as spirit release. So the medical intuitives are very attuned to looking to see if is there a presence of an entity around the person. Is it positive or negatively motivated? And what does that person need for treatment? So I'm just looking at my watch now to try to discern where I am. I wanted to say that my experience going into a spiritist center was that I would get an energy work or energy passes even after I took my coat off before I entered into the center. So they are extremely generous in offering these passes, recognizing that they just help to make people feel better as they enter into the centers. So I mentioned the story of Marcelo, but the spiritists treat everyone in spiritual emergency in a unique way. So someone may need psychiatric medication, but they don't over rely on it. Everyone, if they want it, can get energy work. If they want it, blessed water. If they want it, prayer. And certainly fellowship is very much condoned. In fact, in one spiritist center I went to, it says fellowship is the most essential part of the healing. So the compassionate understanding, as mentioned, is there, and people are wanting to grow that compassion. That's part of the philosophy of Spiritism itself. What Spiritists will also offer people is a cognitive framework. So Marcelo had a notion that the kinds of experiences he was having meant that he was a lunatic, and he needed to change his thinking, to study, to learn, to listen, to be with other people like himself. Again, many kinds of therapies are used. If people are not responding, they can have a session called disobsession, but they would not be present during that particular spirit release. So in this country, as far as I know, most spirit release is done with a person present and very much involved. But the disobsession is with the Brazilian Spiritists is done when the person is out of the room. So it's done remotely. And I do think that this notion that some people in spiritual emergency are like coal because they feel like they're in a very dense and dark place, but actually, if they're truly in a spiritual emergency, it's like they're a diamond in the rough. And if they get the appropriate support, they become that diamond, like Marcelo has. So the Spiritist therapies in some detail, I don't have a lot of time to go into this, but the energy passes here are depicted as the people sitting are getting the energy work done. The people standing and in colored clothes are offering the passes, and their desire as the pass giver is to be like a hollow reed, so that the energy of the universe or the energy of positively motivated spirits can come through them and be channeled directly to the person who's receiving the pass. In this depiction here, there are two men who are actually in spirit, who are dedicated to helping a pass giver become more powerful in helping with the healing of the person receiving the pass. Some of you may be familiar with Masaru Emoto's work, and he shows us through photographing molecules of water, that if a molecule of water is oriented towards a very positive notion, for instance, a energy worker is holding their hands above the water and emanating the vibration of love into the water, that when a molecule of that water is then partially frozen and photographed, that it will have a very harmonic design. Whereas the opposite is also true. If it's charged with the frequency of hate, for instance, that it will show up in the photograph when it is frozen as a very disharmonic design. So the spiritists, in using blessed water, have been showing us that this can be a very important component of healing. I wanted to show you that the disobsession meetings happen in something that looks a lot like a boardroom office, and there are no candles, religious symbols, incense, and no psychoactive drugs that are used. It's simply a place where people can convene. Oftentimes there are 10 mediums who come into work together, and there's one person who will, in a hospital situation, read about one particular patient and identify their name and what ward they're in, but not much else. And then the mediums go into a deep meditative space in order to get information about that person that can be helpful for their healing. They also get information about any kind of spirit that might be needing also their help, that might have attached themselves to the person who is suffering. So can we import this? I would say we're in a position now, especially in this kind of a group, where there is more awareness of an interest in spiritually transformative experiences and spiritual emergency. We have a lot more acceptance of anomalous experiences now. We have a much deeper understanding and interest in pursuing what is consciousness all about anyway. The materialistic reductionist approach to healthcare is receding or losing hold, as I look at it. Spirit release and soul retrieval therapies are gaining acceptance. But can we really import a spiritist way? And I have been contacted by several people who say, when are we going to have a spiritist psychiatric hospital, Emma? You lead the way. Please create one. We need one. And one of, well, of course, there's a lot of red tape that we have in the United States, at least, that can really obstruct the creation of such a hospital in today's world. And we also need to recognize that spiritist mediums never charge a fee, which is extremely different than what happens in the United States. Spiritist mediums also work in supervised groups. They don't work alone or go solo, as it were. And one reason is because the work is difficult. And if you don't have supervision, sometimes people can get, a bad hair day or just difficulty and find it, get out of balance. So some of you who know the story of John of God recognize that he got way out of balance and really is now in prison as a result, even though he was a world famous healer and helped thousands of people all over the world. So there is international interest in this. This is a group of people that I took, they're all healthcare providers who I took to Brazil to learn more about Spiritism. The resources I promised you I'd tell you about, the books and films that I've done are available at imhu.org/store. Books by Allan Kardec, the person who wrote the foundational books of Spiritism, are available online. Go right to Amazon.com. There are also many books by Chico Xavier, who was an extraordinary medium in Brazil. He wrote a channel, 400 books. Some of them are in English. And if you like to read about Spiritism through stories, that's the person to go to, Chico Xavier. And a film was made from one of his books that is available on YouTube, and it's called Astral City, A Spiritual Journey, which tells about a doctor who was actually quite egotistical, going through a transformation as he passed away onto the other side, and what happened on the other side with him. It's a beautifully done professional film. Another way to learn more about Spiritism is a course that we're offering at IMHU on Spiritist therapies. It's available right now. You could sign up right away. We are even offering continuing education credits. And on June 15th, there'll be a 1-hour live discussion afterwards. And the course is really pre-recorded interviews with leaders in the field, like my associate Dagmar Ramos, who's a psychiatrist and also extraordinary medium. So if you're interested in the 7-day seminar that we offer in Brazil, you can go to imhu.org again and look for it under the main tab for practitioners. This is only for a small group of 10 people once a year. And I mentioned that I also do a lot of work with training people about spiritual emergency and how to care for people in spiritual emergency. I'm thrilled that so many more nurses and psychologists are coming to get this education that they missed in their conventional training. And that is also available on our website. And here is my contact information. If you would like to contact me at IMHU, and also I do personal consultations, and that's through my personal website. Okay, 2 minutes over. That's pretty darn good.
Well, we'll get into our question and answer
Okay.
portion of the presentation.
Thanks, Robert.
And first question is actually from me.
Oh,
Is it difficult to obtain spiritism support in Brazil if someone is from another country? And another part of that, what language is primarily used in these settings?
Portuguese.
That's what I thought you were going to say.
So, yeah, if one goes just directly to Brazil and says, yes, I want to get involved in these community centers, or I have a loved one that I would love to get, cared for in one of the Spiritist psychiatric hospitals, there is a difficulty right now with language, because most of the, well, I should say all of the Spiritist centers, certainly in Brazil, are run in Portuguese, and the Spiritist psychiatric hospitals in Brazil are all managed by people who speak Portuguese as their first language. That doesn't mean that there isn't an ability to find a translator and have that translator be able to help negotiate participating in some of the events. But that's the way it is right now. And I've been working with my associates there to see how can we work something out so that people who are English speaking or speak another language can come and get the kind of care that's offered here, because it isn't offered anywhere else in the world. So another way to answer your question, though, Robert, is to say that there are 70 Spiritist community centers in the United States, and most of them cater to people who are coming out of Brazil or out of South American countries speaking Spanish. So most of the events are in Portuguese or Spanish, but more frequently now, there are events that are offered in English, because there are more people who are interested in learning more about it.
Thank you.
Yeah.
Susan has a question for you. Can Spiritism help heal addiction?
I went to the largest Spiritist community center in Sao Paulo, and they dedicated the basement floor, which wasn't, dark and dirty. It was just the very bottom floor, to people who were suffering from addiction. And so they have a very keen idea of how many people are suffering from addiction in Brazil, and offer their services. And that would include doing 12-step programs and other programs that work, because again, it isn't only just the Spiritist therapies that are offered. They draw from whatever is working from whatever part of the world. And so there's a lot of openness around that.
Thank you.
Yes.
I have a question here from Julianne. Does spiritual emergency always bring forth gifts? And what are examples of these gifts? And what if you don't want them?
What a question. So I would say that spiritual emergency is rooted, in spiritually transformative experiences. So that doesn't necessarily, though, mean that someone is supposed to be working or first learning how to be a channeler or energy worker or something of that kind. It could be like a client I just had the other day, someone who entered into a extremely high state of consciousness where they were completely engaged with their soul level and recognized that as a soul, they came into this body. And so the question for her was, well, now what? Now that I know this, but I'm living in a world that doesn't recognize this truth. Now what? This is disturbing for me. But basically, she'd had a very high experience, and nobody else in her extended family had that kind of experience. And she was just trying to sort out what to do about it, how to live her truth, how to be authentic. So she was actually extremely interested in helping other people, but she was having just difficulty keeping her feet on the ground. And so grounding, learning how to be grounded and also maintain higher consciousness, which can be blissful, but maintain that higher consciousness seemed to be really where she needed to go. So it wasn't like she had to change her job. It was basically learn how to integrate and maintain a higher consciousness or higher vibration. And I don't know if Mark Anthony was talking about this, but maybe a lot of people listening today would agree that the more people who maintain that higher consciousness, the more it can help actually elevate everybody else in the world. So there is a kind of job that goes along with having a spiritually transformative experience, which is if you move into those higher states, you are, without necessarily wanting to change your role in life, you are actually uplifting others. So there isn't, I don't think, a need to change your work life. But on the other hand, if you have spiritually transformative experiences and you start getting the notion, oh my God, I can see energy, I can see my own, I can see my partners, I can see my kids, I can see others, does that mean I'm supposed to do something? Or I'm having a lot of mental telepathy, does that mean or conversation with spirits, does that mean I'm supposed to converse with them? I wouldn't say it means that necessarily, but if we repress anything in our life, repress our love, repress our anger, repress our sensitivities, it leads to a more limited life. And generally speaking, what I've noticed is that whatever it is that we're repressing occupies a meaningful place in our life, and it might be a destructive place in our life. Repression usually is about stopping the flow. And when we try to stop the flow, it can be very troublesome for us.
Thank you. I have a comment in the chat for you from Gail. And I love to see these because that's why we put on these presentations. I had 2 emergencies and got treated with anti-psychosis. It was a hell. Thank you for what you're doing. That's for you.
I appreciate the acknowledgement. There needs to be a lot more of us doing what this work is about.
From Julianne, does Brazil have lower incidence of mental illness and use of prescription psychiatric medications than other countries where spiritism is not part of the culture? Great question.
Yeah, it is a great question. And I don't have the statistics at hand to give you a really accurate answer about that. I would say that there are different dynamics going on in Brazil. You know, there is more poverty there. There are more people living at a very at a level, financial level that is extremely low. And so some people couldn't even afford psychiatric medication, even if it was suggested as right for them. So I'm sorry, I can't really answer your question, but it's a good one.
Sure. This is from Carlos. Can this all be done remotely, or it requires to be in Brazil for this kind of support and treatment? I think you kind of reflected on that, but this is for Carlos.
Yeah, thank you, Carlos, for the question. There is remote healing that is done, as for instance, I mentioned that when the disobsession is going on in the spiritist hospitals or community centers, the person being helped is not in the room. So they might be in another room of the hospital, but then on the other hand, they might be in another country or on the other side of the world. So remote healing is done. But I think I mentioned at one point that there was one spiritist center I went into that had a large sign saying fellowship is actually at the root of what we do in terms of affecting healing. So if someone is alone, let's say in the United States, and is looking for the kind of help that they can get from Spiritism, how are they going to get that feeling of affiliation and community that can happen when you're actually part of a Spiritist center and you're getting energy work through people in their physical presence, and you're also praying with other people, or you're also going to classes and talking with other people about the events of the day and how does it interface with Spiritism. All of those kinds of events actually strengthen community tremendously, as well as strengthening the risk. I mean, it's strengthening our notion that these extraordinary experiences exist and that we need to live into them. So community is very important, and it's very hard to get that remotely.
Thank you. This is from Anne. Interesting. How do negative entities come into people who are positive and of a high level of awareness?
Right. These are all wonderful questions. So the Spiritist view on this is that if someone fills themselves up with the light of God or source or the universe, whatever your name for that huge energy is, that is all love and compassion. If someone totally fills themselves up with that energy, there is no room for any attachment from any negatively motivated entity, period, exclamation point. But if there is some part of that person, let's call it a lack of forgiveness, or let's call it a desire for alcohol. So if there's some part of that person that is not resonating on a very high vibration, and that is in fact still trapped in some negative or lower motivation, then that's like a sign to a negatively motivated entity. Oh, I can go over there and be somewhat of a parasite on that person and feed them negative thoughts that will actually expand on what is already inside of them. So maybe that gives us the opportunity then to recognize, oops, I've got some cleanup work to do in myself. But unfortunately, for the person who is not self-aware and has not moved into a higher vibration, they might just have absolutely no idea what's going on, and just feel like for some reason or another, suddenly they are stronger in their lack of forgiveness to others, or they're stronger in their addiction. I hope that answers your question.
Thank you. One last question.
Okay.
We're about out of time. This is from Santo. Don't know much about John of God. Why did he go to prison?
Oh, it's an awful, awful story. But basically, he went to prison because he was found out to be abusing several people, both mostly women, mostly adults, but also going all the way back to children. And so that means sexual abuse and possibly also physical abuse. It's a very sad story. And it's been extremely difficult for anyone who had interactions with John of God to recognize that he was, or is possibly still, has an extraordinary capacity to assist people with healing. And how could someone who has that extraordinary ability also have this other shadow side? But he had both.
Well, that concludes our session today, and SAI wants to thank you, Dr. Bragdon. You just did a great job. Thank you for everything you've done for us, and your presentation was great. Thank you once again for coming.
Thank you, Robert.